Warm welcome to this very special webcares session co-hosted by the Women Entrepreneurship Platform of Niti Aayog and Apollo Hospitals. Our sincere apologies for the slight delay, but let's start the session now. As women entrepreneurs, leaders, and change makers, you are the driving force, not just in your business, but in your families, communities, and industries. Yet, too often, the person you put last is yourself. Taking charge of preventive care and your own health is one of the most impactful decisions a woman can make, not only for herself, but for those who depend on her. Today's session, from screening to survivorship, understanding modern cancer care for women, is about taking charge of your health with knowledge, agency, and leadership. Today, we are here to talk about not fear, but power, the power of prevention, the power of early detection, and the power of navigating treatment and recovery with clarity and strength. Today's session focuses on common cancers that affect women, some of them being breast, cervix, and ovarian cancers. These are prevalent in Indian women, and this session aims to equip you all with clear, actionable knowledge on prevention, screening, early detection, treatment, and navigating recovery with confidence, because timely care leads to better outcomes, especially in cancer. Low awareness about symptoms, the stigma, the confusion, or just lack of time often leads to delay in detection and treatment. Most cancers are better treated when detected early, and regular screening helps you to identify concerns before they progress, often even before symptoms appear. This session will therefore offer practical guidance on what screening, who should get what, when, and how early detection can support a better outcome. Understanding personal risk also empowers better decisions. So this session will also address key factors that influence cancer risk. And if diagnosed with cancer, a diagnosis is not the end. Today, many women recover completely and return to full lives thanks to advances in treatment and care. So this session will demystify that as well. So listen in to our experts and ensure that you're able to take decisive control of your health through timely and informed screening. The session should help you to respond with clarity and confidence when faced with a cancer diagnosis. Do empower others with credible and science-backed information at work and at home. And the session should help you to lead by example, making health a core part of sustainable leadership. We are extremely honored to have with us three outstanding doctors specializing in cancer care who will demystify for you what you need to know, what you need to do, and how you can lead yourself and others towards better health outcomes. I'm very honored to introduce each one of them to you very briefly, I'm afraid, because each of one of their profiles reads almost like a textbook. So I'm honored to introduce to you Dr. Geeta Kadayaprath, Senior Consultant, Breast Surgical Oncology, Oncoplastic Surgery and Lead at the Apollo Athenaa Women's Cancer Center, New Delhi. Dr. Kadayaprath has over 25 years of experience in breast surgery, and she has been trained in several prestigious institutions like the Lady Hardinge Medical College, Delhi, the Maulana Azad Medical College, and she's also done her FRCS at Glasgow. Passionate about holistic care in breast cancer patients, she believes in care beyond cure. She believes in empowering patients to take optimal decisions and is a keen advocate of patient support groups to handhold and make the cancer journey easy. Welcome, Dr. Kadayaprath. Honored to have you here. Also delighted to welcome Dr. Jyoti Wadhwa, who is a senior consultant and lead medical oncology and precision oncology at Apollo Athenaa Women's Cancer Center, New Delhi. She's a highly accomplished and renowned medical oncologist who has been trained at premier institutes in India and abroad. She holds an MD in medicine and a DM in medical oncology from the All India Institute of Medical Sciences, New Delhi. been a Commonwealth Scholar at the Imperial College School of Medicine, London. Also authored 2 books on breast cancer and on diet and cancer. Thank you so much for joining us today. And finally, I welcome Dr. Jyoti Arora, who's the lead in the radiology department, breast imaging and interventional radiology at the Apollo Athenaa Women's Cancer Center, New Delhi. She's been trained in the UK in breast imaging and PET-CT, a former NHS consultant. She's a pioneer in scarless removals of benign breast lumps and MRI-guided vacuum biopsies. Her expertise actually lies in picking up cancers as small as 2 to 3 millimeters and ability to biopsy them with very, very precise techniques. And this is to enable management of early breast cancers very well indeed. Thank you so much, doctors, for joining us today. Let's get into the session. And dear viewers, please feel free to post in your queries. We've already received quite a few of them. Thank you for sending them in, and we'll try to take as much as we can. So let me begin by asking Dr. Wadhwa, we often hear about the fact that early detection saves lives for most diseases, but especially for cancer. So what does it really mean in practical terms for cancer, and what difference does it make in the outcomes?
So hello, everyone, and thank you for having us all over in today. Could you repeat your question, please?
Yes, Dr. Wadhwa, apologies for the technical issues. So I was saying that, we often say early detection saves lives for all diseases, but particularly for cancer. So I just wanted you to begin this session by setting the tone and, saying why it's so important to detect cancer early and how does it affect the outcomes?
Yeah, so very important question. And early detection does save lives. And in fact, early detection is the strongest weapon that we have today in our fight against cancer. So early detection has many advantages. It detects cancer when it's in its smallest and most curable state. So by early detection, what we are aiming to do actually is trying to pick up cancer even before the patient has any symptoms suggestive of cancer. And this is the beauty of a screening test. So when we apply a screening test to these women who still have no symptoms to suggest or raise a suspicion of cancer, and we do these tests, say for breast cancer or cervical cancer, and we are able to pick it up, then what happens, we are able to pick it up at a stage when it's most curable, when it's most easily treatable, with least toxic treatments, least costly treatments, and therefore the outcomes, the quality of life are amazingly good. So that's in where lies the strength of early detection tests, especially the screening tests. And then going beyond the screening tests, making the population, the women in general, aware that such a thing can happen to anyone. And it's good to be aware, feel empowered, and seek medical advice in a timely manner. So don't ignore any symptom and seek a medical advice from the appropriate doctor in a timely manner so that you are able to get it diagnosed when it's still stage 0 or stage 1. And when we can offer beautiful non-disfiguring treatments, sometimes the patient may get away without any chemotherapy or any other medical treatment or radiation treatment. Just a simple removal, surgical or non-surgical removal, may suffice. And therefore, the patient will be able to live not only a long, healthy life, but also a life with good quality of life, right? So that's why early detection is so important.
Dr. Geeta, yeah, sorry. Just wanted to go on to perhaps a focus now on the cancers that commonly affect women. So what would you say these common cancers affecting women are in your experience? And could you give us, I know that each one is probably a chapter by itself, but for our viewers, some of the earliest warning signs for these cancers and symptoms that women should always seek medical help. They may be innocuous, they may be indicating something serious, but I think what would these symptoms be and what should busy women keep looking out for?
So the cancer is, as of today, it's breast cancer in women. Earlier, it used to be cervical cancer. Now it is breast, which has overtaken it in about in the last 10 years or so. And the other cancers that you would associate with women would be uterine, ovarian cancers, and so on and so forth. So, if you look at the symptoms, if you look at breast cancer, the commonest symptom is painless lump. And I say painless lump is because it's painless by a lot of women later than you would otherwise expect them to come in if had it been a painful lump. And other than a painless lump, there could be nipple discharge, which is spontaneous, which could be watery or bloody, could be contraction, or could be change in texture of the skin, which would be more like an orange peel. And sometimes you can also see dimpling of skin. You know, you could find that there is a sudden indrawing of the skin of the breast, which could also be an indicator of breast cancer. That we common so it is still a problem in our country, but fortunately now better hygiene, vaccines, and growing awareness of patterns which are easy to be easily. We are seeing lesser of cancer, which is very hard. But then one should be aware of the symptoms of cervical cancer as well. Things like intermenstrual spotting, or even any spotting that is happening out of the usual cycle should be taken into account. Any foul-smelling discharge which has been persistent over, say, a month or so, then you should get yourself investigated. If there is any pain at the time of intercourse, or there is any persistent pelvic pain and a lot of foul-smelling discharge, like we said. So these are things that can actually portend cervical cancer. And the third cancer, which, and even endometrial cancer or uterine cancer will possibly present with bleeding, usually postmenopausal bleeding. Any bleeding that happens in older women, which, you've had menopause and 2 or 3 years down the line, you find that there has been a spotting, that should be taken very seriously. And other than that, ovarian cancer is one that kind of really foxes all of us because it does not have a particular symptom that you could pin down on. And ovarian cancers could just come through like, that there is some sort of bloating of the abdomen, that there is, you equate it with indigestion and you take medicines for acidity, and the problem is actually brewing inside. And by the time you find out, it is already an advanced stage disease. So ovarian cancer is the hardest to pin down, but any symptom does not go away for, say, more than 3 weeks. It is persistent, needs to be adequately investigated and then figured out as to what it is. So these are the usual things that you would see with cancers associated with women. And I always say that cancer does not announce itself. The symptoms of cancer are pretty much similar to the usual diseases that one has. Like I said, the lump in the breast. You can have normal lumps in the breast. 8 out of 10 times, the breast lump would be a benign lump. But then you have to get it investigated to know whether it is benign or malignant. So that trip to the medical facility and to the expert is very, very important, because we see this every single day that, patients have kind of taken it easy and believed the lump to be benign without actually investigating it. So that is where I would park my discourse.
Thank you, Doctor. Before we go on to Dr. Arora, I just wanted to ask Dr. Wadhwa about the Indian context as well. So these cancers which affect the Indian women, are Indian women in any way more vulnerable, or do they have any unique risk factors as compared to the global population, you think?
Yes, what you say is absolutely true, because the Indian women suffering with cancer, their profile, their epidemiological features, and the biology of the cancer in them is totally different from the women in West who have cancer. So, for example, the women with cancer in India, at the age at presentation is almost a decade earlier than the West. So we get to see much more proportion of younger patients in India. So these patients also, in terms of cancer biology, have more aggressive cancer. Say, for example, if we talk of breast cancer, there is a subtype of breast cancer called triple negative breast cancer, which is most aggressive. And in India, almost 20 to 25% of the breast cancer patients would be triple negative, compared to just 15% in the West. So they inherently, therefore, have to have more aggressive tumor biology to begin with. Also, the age at presentation, call it lack of awareness, or the screening tests availability or accessibility, lack of that a majority of our patients, the women patients, they present at advanced stage. So almost 2/3 of our patients would present and get diagnosed in stage 3 and 4, whereas it's just 1/3 in the West. So advanced stage at presentation is another factor. See, this is contrary to some of the reproductive factors in India are actually in favor of our Indian women. Say the early childbearing and multiparity is protective against some hormone-driven cancers. But still, we see a lot more of these patients in our population because of some other factors. Like more recently, we have seen the lifestyle changes. So obesity, the prevalence has gone up, the sedentary lifestyle. Now, more working women, as you started in your introduction with, putting health on a back seat and, making their career and their profession